So let us start our session with some either a case discussion or whatever questions you have. Welcome, Dr. Manisha Kumari. Welcome. So let us discuss a case today. I hope everybody joins in early so that we can start a discussion as early as possible. Now, there are some cases where the interpretation is very important. For example, good afternoon. For example, I've always discussed a few remedies, few instances or few cases where we have got very, very good results. Now, example, if you see a chamomila child, if you see a Sina child, you always think they are very irritable, they are very angry children. Okay, they are there. But if you look at the other side, if you look at the other side of these remedies, it will be noticed that there is a symptom where the patient says that he does not like to be spoken to, or it is said that aversion to be spoken. Now, this just had a beautiful case where the patient says कि मेरे बच्चे को ऐसी बात भी किए ना उसको पसंद नहीं, he just wants to keep quiet. Sometimes what happens if our orientation of a particular medicine is very fixed, then we fail to understand what is the other side of that remedy. For example, I might have discussed with you the remedy like phosphorus or pulsatile, which has different shades. In the same way, there is a symptom where the patient has aversion to being spoken, and immediately we get few remedies, and the first remedy that you should remember is chamomilla, iodum, cinna, and natrum sulph. Sounds very, very interesting, or if sometimes the patient comes and tells you कि इनसे बात करो ना, तो वो बोलता है हेडेक बढ़ गया, पेट दर्द बढ़ गया. If you talk to this person, he says, don't talk to me, headache increases, my stomach increases, my leg pain increases, my arthritis increases. This is the reaction of the patient. So we are going one step ahead. Spoken to aggravates, or spoken to being aggravates. I welcome Dr. Vishal, Dr. Palak, Dr. Mithali, Dr. Babel, Dr. Amulya, Dr. Anja, and thank you, Dr. Babel. We received a gift from Germany. It was really nice. Thank you. So, aversion to being spoken aggravates. And immediately you have to think about few remedies which are very, very important. And you'll be surprised that the remedy has platina, staphylos aureus, natronure, and chamomilla also. In fact, calcarea carb also. But because we have fixed ideas of few remedies, we never think about these remedies, and that's why we fail to prescribe either chamomilla or calcarea or platina or natronure. But the symptom is such an important symptom, aversion to being spoken to. Heal with Homeopathy joined, welcome. So this is again a very, very important symptom. And if you open your Mater Medica and just open chamomilla, it is basically written that anger, peevish, irritable, anger, snappish, cannot retain a civil answer. But you have to think that a chamomilla patient does not want to be spoken to also. That is so much important, So I'll just go further in the Mater Medica. But before that, we have a question. So please explain the approach of recurrent affection of typhoid cases. Basically in typhoid case, what happens. In typhoid cases, what happens? Just a minute. In typhoid cases, what happens that it is so important to understand if the patient is suffering from typhoid, and when the typhoid is cured with some medicines, especially orthodox medicines or what medicine we are using, it not homeopathy. What happens in these cases? The immunity goes down, and the patient will most of the time tell you that he is not able to, after typhoid, is not able to do this, do that. So the whole metabolic rate becomes slow. In that case, you have to give an intercurrent remedy or a remedy to open up the case, and that is typhoid. After that, maybe you can basically give your remedy what you have thought of. So whatever I understand from your question, Dr. Amulya, if I cannot understand, you can ask more. Welcome, Dr. Shraddha, Dr. Kumari Manisha. Can we manage cough due to cardiac problem with chronic recurrent sore throat, left-sided tonsil enlarged and tonsillar stone found? Cough aggravates by exposure to and morning and evening also due to. Why can't we? We can definitely manage cough, any cough. Good evening, good afternoon, Dr. Disha. We can definitely manage chronic cough, especially cardiac cough. And if you go to see in a repertory or in a Mater Medica, there are certain remedies which are very, very important for cardiac cough, For example, if you see typhoid, if I have given, I basically gave it 1M potency. Okay, 1M potency. So we have a classical remedy where the cough is related to heart complaints, Dr. Manisha, and it is such an important symptom that you have got. Sometime what happens, if the patient is suffering from chronic heart problems also, and he's suffering from cough, and sometimes you basically prescribe the remedy because of cardiac cough, and his elements of cardiac elements also get cured. For example, for cardiac cough complaints, we have remedies like lacasis, we have naja, we have tabacum, we have laurocerasis, we have a simple lycopodium also. These are so important remedies, where if you solve this acute problem which are related to cardiac, the cardiac symptoms also gets better and the patient is cured. So it is very important to manage these type of cases with a particular symptom that you have noted, that is cardiac cough. I hope you understood that question. Dr. Vishal says cough series made very nicely. Thank you so much, Dr. Vishal, and I hope you get some benefit in your practice also. Dr. Ashwin, welcome. How to manage newly diagnosed case of hypothyroid? Only on yeah. When see hypothyroidism in our pathy, we have wonderful results, lot of cures on case of hypothyroidism, and it is very important for you to understand that hypothyroidism basically is a metabolic disorder. Complete case taking is very important, and in my practice I have seen, I normally start with 1M potency and it gives fantastic results. Wait for some time, give a dose, wait for some time, after 3 months repeat a T3 T4 TSH, you will get fantastic results. It is constitutional approach. See, I have never got results while prescribing thyroidinum 3x or thyroidinum 6x. I used to use it previously, but I have not got any results with that. Dr. Ashwin Jain, sir, what should we do in case of fever, especially children? अगर बुखार नहीं जाता है, मरीज स्पेशल पैरासिटामोल ही देता है, please suggest. Yeah, Dr. Jain, of course, treating fever would be very difficult when you start a practice, but simple as that. If the patient has fever, ask some symptoms, ask the symptoms. Dr. Jain, सुनिए, वो सिम्टम पूछिए पेशेंट से, वो सिम्टम पूछिए कि जो फीवर में पेशेंट अलग कर पाता है. फॉर एग्जाम्पल, पेशेंट बोलता है कि बहुत, मम्मी बोलती है पहले बहुत बात करता था, बहुत बात कर, लेकिन बुखार में क्या बहुत शांत हो गया, बात नहीं करता, चुपचाप बैठा रहता है, वो एक सिम्टम इंपॉर्टेंट है. या फिर मम्मी बोलती है पहले बहुत ही शांत था, बुखार में बहुत ही बात कर रहा है, वो भी एक सिम्टम इंपॉर्टेंट है. उसका थर्मल्स देखिए, थर्स देखिए और फिर प्रिस्क्राइब कर लीजिए. इतना इंपॉर्टेंट है. चेंज ऑफ सिम्टम एट द टाइम ऑफ फीवर, एंड दैट इज यू हैव टू अंडरस्टैंड द केस. Good afternoon, Dr. Vaishnav. Sir, shall we start with the case? Yeah, you can start the case with typhoidinum, or it is written in Carboage that any symptoms are related to, if you see Carboage, it is beautifully written, and if you have Allen's keynote, you can see this is a very important aspect in Carboage. It is written, what it is written? Patients who have never fully recovered from the exhausting effect of some previous illnesses. That could be anything. Dr. Allen's right, it could be asthma or measles or pertussis in childhood, or you can say whether vitality has gone down or weakened because of some exhausting disease or bad effects of exhausting disease. The first remedy should be Carboage. Such an important remedy. If you don't understand, if you feel a typhoidinum is not working, then you must start with Carboage, or it is said any carbon would do, because those are slow acting remedies. I hope you understood, Dr. Amulya. Carboage. Read Carboage in Allen's keynote, first two paragraphs. Important. Cough also aggravated by fixing anything, frying anything, and unlike heart rate बहुत है, अगर चेस्ट पे हाथ रखते तो फील हो जाता है. चेस्ट में बहुत क्रेपिटेशन था तो एक्सरे कराया, नॉर्मल शोज कार्डियोमेगाली. Yeah, so that's why I was telling you that sometimes what happens, cardiac cough, as you diagnose it very perfectly, and it is sometimes, as I told you, cardiac cough remedies are so important. That's why if you go and see cardiac cough in our Mater Medica, you will understand that the remedies like naja, which also has a lot of palpitation, lacasis, which also has a lot of palpitation, laurocerasis, which also has a lot of palpitation, and it is so severe that you can hear that palpitation. So it is very important to understand that these remedies basically would act in these type of cases. I hope you understood this. Or you can see the mathematics of these remedies, and these remedies basically, see, if you have cardiac cough, the palpitation would be more. And in that case, if you see remedies like lycopodium also, and one remedy also I can remember, lycopus, that's also very very important remedy, which basically has these type of complaints, so in this case, you should remember these remedies which have both the symptoms of increased of palpitation also, and anxiety also. Thank you, Dr. Jain. Yeah, so thank you, Dr. Manisha, and I hope you got some answers for your questions. Few questions are there on my WhatsApp, but please, I would tell everybody to see on Instagram or YouTube, because it becomes difficult to manage all the three social medias. Yeah, I hope you got the answer. Thank you, Dr. Jain. Thank you, Dr. Manisha. As we go, bad breath, please tell remedies for bad breath, tonsils, hypersensitivity to cold air, headache after exposure to cold, cough justifies come in contact with. Yeah. So whenever you are getting, see, one symptom you are getting, Dr. Pandey, very well, that the patient is, whatever complaints are there, the patient is suffering from winter or cold. So if you group this, okay, if you group this, you will find that these are the complaints where the patient is aggression from winter. So you take, this is a generalized symptom, or Boninger's theory, that generalized symptom of aggression cold air. And then you can see that the bad breath is what? Very bad breath. We have very, very bad breath from the mouth in cases of nitric acid, hyoscyamus, arsenic, very bad breath from the mouth. Especially the patient says that a bad breath basically is after eating. Then you should think about sulfur, mercury, nux vomica, and carbohydrates. Sometimes, the patient says that मेरे को बात इतनी ज्यादा ऑफेंसिव है कि मैं डिस्क्राइब नहीं कर सकता कौन सी बात है, बिकॉज समटाइम्स द पेशेंट इज नॉट एबल टू टेल यू द सिम्टम्स. सो जनरलाइज बेड ब्रेथ, देयर आर फ्यू रेमेडीज दैट आर वेरी वेरी इंपॉर्टेंट विथ aggravation, as you say that the patient has aggravation from cold air and tonsils, and it is very bad. Think about few remedies you can write down: Merxol, nitric acid, carbohydrate, creosote, nitramur, lachesis, sulfur. These 6 remedies are very very important in your case. And in your case, the patient is aggravated by cold air, cold atmosphere, cold surroundings. So you can think about arsenic, carbohydrate, chamomilla, Merxol, creosote, nux vomica. Good afternoon, Dr. Meera. Amenorrhea patient not responding to any remedies there in that induces menses. Yeah, see what happens, Dr. Amulya. In homeopathy, it is nature's law, no? Menses is according to nature. So if there is amenorrhea, so that something terrible has happened in the patient's constitution, patient's mind. So the hypothalamic switch has been closed. I have never seen or given remedies where it is like patent to give the remedy and the patient gets menses like restaurant. But few doctors prescribe remedies like, we have pulsatilla, we have senecio. Senecio is a good remedy when there is functional amenorrhea. So in your case, if there is no other cause, there is no PCOD, there is no primary cause, and still the patient does not have menses, so you can think about remedy which causes functional amenorrhea, and the remedy is senecio oris. Would be carbohydrate indicated to start with for long COVID? Patients have symptoms of sleeplessness, weakness, shortness of breath, fear, and fatigue. Yeah, see, if you have seen that lot of patients after COVID has come with long COVID symptoms. Now, see, you have to say the patient has been never well since COVID. If it's a disease, influenza type. So you can think never well since infectious disease, or never well since influenza, or never well since pneumonia. So in Fatak Repertory, we have remedies like never well since infectious disease. Soranum is there. Never well since influenza, Gelsemium is there. Never well since pneumonia, so Kalicarb is there. Never well since typhoid, we have that remedies also like carbohydrates, pyrogen, soranum. So COVID, you can either use Fatak Repertory and use that rubric never well since XYZ, or if you have complete repertory, it is written never well since pneumonia, which was extended symptoms of COVID. So we have remedies like Kalicarb, Carboge, and Carcinose. So you can use both the rubrics and get to the remedy. What two repeaters I have seen in my case, okay, when I'm practicing. Sir, there is any scope of homeopathy in case of BI follicle tubal blockage? I use Ictholium 30 to 1M and constitutes also prescribed, but get any results? Yeah, there is definitely good results when there is infertility because of tubal blockage. In this case, do understand, Dr. Jain, that tubal blockage basically you have to understand how the patient has evolved from marriage till from what you call menarche to marriage. And after marriage, when did the patient start thinking about getting a child? And what went wrong during that period, which has caused the tubal blockage? I have seen a very, very important history from menarche to marriage and from marriage to the thought of having a child. Understand this, decode this, and there you will find something which has troubled the patient mentally so much where the patient is not able to come out of that and he suffers from or she suffers from tubal blockage. Mostly, if there is left-sided tubal blockage, the problem will be with the husband or with the family of the husband. And the right side tubal blockage, you will see that the patient wanted to work or she wanted to continue her work. And before marriage, the boy must have told that you can work, but suddenly after marriage they said you can't work, and that trauma basically would give rise to tubal blockage. That is what I see in my practice. You can also try case taking and get some good results with that theory. Dr. Naridika, welcome. Yeah, thank you, Dr. Smith. Yeah, good afternoon, Dr. Borkar. Dr. Shabbir, yeah, welcome. So I hope, Dr. Smith, that you have used these two remedies, and if you see repertories like in Kent also, I think it might have written that convalescence never well since that, and the remedy is Kalikarp. So if you see Kalikarp, Carboways, these remedies will come in most of the repertories, so you can try those remedies. But if it's a long COVID, do ask the patient what was at that time, and if you don't get result, then go to this rubric. Otherwise, the case taking, if it is good, it would fetch you good results. Okay, yeah, thank you so much. Next, on Instagram, some questions have been scrolled up. So if I missed those questions, you can always always rewrite that. So I was talking about what? I just forgot. Spoken to version 2, and I was talking about chamomile. It is sometimes very important to understand the depth of chamomile and why the chamomile is so irritable, so angry, and what is the elements from. So what, Dr. Annaga, welcome. Yeah, so we have, sir, in tinea case, sulfur 30 was working. How long we could continue it, or else go for 200? No, if it is working, then we should not go for 200. Wait till some time. If the patient does not improve, you can repeat sulfur 230 once, and still you find the case is stagnant, then you can go for sulfur 200. As Dr. Ken says that unless you have tried a single potency twice, don't change the potency. Okay, and it is very good that sulfur is working, because I also feel that tinea cases, these are, is Hindi it is Sherni, very difficult to cure, but if the remedy is working, don't change it. I have a case of 8-year-old girl after separation of parents. She had fever and massive hair loss, daily 100 to 200 strands. She's 80. What should I give? Yeah, Dr. Mira, first I hope you got the remedy of all the 3 cases which I sent you, and I hope they respond well. You can think about remedies from magnesium group, Dr. Mira. That is very important, or a natrum group. Magnesium carb, magnesium sulf, natrum mure, and natrum sulf or natrum carb are very good for this type of indications. Compare that with thermals and modalities, and you should get the remedy. Magnesium remedy fits in this case very well. Yes. So I was just telling you about the other side of remedies, like for instance, I think calcarea I have discussed many of times. Okay, there's one more question. Yeah, so calcarea we have discussed many of times, and there is one thing about belladonna which you also must remember. I hope Dr. Mira got the answer for a question. You can try those remedies and you'll get some good results. So we have, if we don't have questions, we'll tell something about belladonna. Of course, in belladonna, you must always think about that persons. It is adapted to plethoric constitution, and they are lively, entertaining when they are well, but violent and uh, often delirious when they are sick. That is there. But in lycopodium, one thing is very, very important that I've seen in my practice. When these type of symptoms are not there, the vertigo of lycopodium is again very important. Vertigo when stooping, or when rising after stooping, or when the patient changes the position, either from left to right or right to left, from up down, vertigo is there. Now this is a very, very important indication of belladonna. So these symptoms I have found so usefully when I'm prescribing belladonna, that vertigo when stooping, or when rising after stooping, or when every change of position. This is very, very important. Something of belladonna which I wanted to share, because these symptoms basically we can only confirm when we have seen these results in the practice. In belladonna, there is rush of blood to the face, there is white throbbing in the brain, throbbing that always there. But if you don't get this symptom and if you get vertigo, then also belladonna is indicated. Thank you, Dr. Mira. Those 3 cases are feeling much better. Okay, thank you. So, sir, there is a pain in throat received by indicated remedies by complaints aggravated by eating chicken of every time. Is there any remedy for this? There is pain in throat received by indicated remedy, but complaints aggravated by eating chicken. Now see, whenever you are eating chicken, or whenever you're eating fish or mutton or non-veg, you can have symptoms where when the patient is eating bones, bony type of things, it goes in the throat and it pricks the throat. In those cases, we have remedies, like it may cause abrasion and then it may cause cough, or the patient feels that something is stuck and that is causing a cough, or some irritation. So we have lots of remedy, but do think about 3-4 remedies which are very, very important. Nitric acid is first, second is argentum nitricum, third is kalicarb, and fourth is hipparasulf. Do think about these remedies. Please tell remedy for bad breath, tonsil stone, chronic pharyngitis, hypersensitivity to cold, air, coughs, justifier. I told you something about bad breath, I think, Dr. Pandey. I remember a case of bad breath. The basically, sir, we want results in kilowatt of chest. Just a minute. So we'll just discuss some bad breath. In cases where you find that bad breath sometimes is not only related to mouth. You can have bad stomach, fermented food, and a lot of other things which causes bad breath. So your question should be exactly what. But see, now bad breath, I told you, very, very bad breath. The patient is, if somebody goes in the room also and the patient is there, you can feel that bad breath when the patient starts speaking. Do think about arsenic, do think about nitric acid, hyoscyamus, and phosphorus. Lot of very, very bad breath. Just offensive breath, I told you, arsenic is there, lacus is there, creosote is there, sulfur is there, nitric acid, kali carb, natrium, carbo. These are very, very breathing is there bad and very offensive. Now you have to differentiate where is the bad breath: in the morning, eating, after eating, during cough. These are all headache, menses, and the patient will tell you something which is very peculiar to his bad breath. And then if you get a defining symptom, then you can take that rubric. Otherwise, offensive breath from the mouth, you have, I don't know, hundreds of remedies. Sir, we have, can we get? Yeah, we can get definitely. But let me tell you, Dr. Joshi, Dr. Amit, good afternoon. Let me tell you, Dr. Joshi, I also find it very difficult in cases of keloid, because see, keloid does not have a few more symptoms and it is very difficult to treat. But I have got few results with few medicines which basically I have discussed before also. But of lately, I am using thiosinaminium in LM potency, which is giving very, very good results. So you can try thiosinaminium in LM potency. Then we have lapis alba, we have graphitis, we have nitric acid, and lots of remedies. But if you have a basic cause, that keloid is because of burn, keloid because of injury, keloid because of an accident, or there was a stitch on the keloid. So in this case, to decrease the tendency or to treat the tendency, you must give first an antipsychotic remedy like thuja or natrum sulfodalcamar or midorinum, and then start that remedy which you feel is right, and it will give you very good results. Like of lately I told you, thiocyanamide has in potence giving me good results. Yeah, Dr. Trivedi, welcome. So let us go further. I hope the half an hour finish is very early. Before I start, I feel the half an hour is going to get over. You can shoot few questions more before we close. Dr. Hiten, Dr. Joshi, I hope you got some idea. So bad breath, Dr. Pandey, I hope you got some remedies. Very, very bad breath. It is like cadaverous odor from the mouth. Think about nitric acid. Think about arsenic. Think about uh, hyoscyamus. And generalize, you can think of so many remedies which I have told you. So can we go further with few questions more? Yeah, Dr. Joshi, and you definitely give the remedy so that we can know that it is working. Otherwise, keloid will have lot of remedies. And for me also, if you ask me, for me also keloid is very difficult to treat. But see, if you see keloid now, there are so many remedies. Like you can think about, I've told you, you can add few remedies also, Dr. Joshi. Like fluoric acid is there, silicia is there, lacasis is also there. But these are remedies which I have used at second grade, first grade remedies. I have told you what I have been using. Yeah, good afternoon, Dr. Nojod. So if the keloid is developed or is on its own, so basically there's a miasmatic, the miasm has to be tackled first, the antipsychotic miasm. So your case taking should be on that miasmatic level, give an intercurrent so that you can open up the case and then proceed with the case. Yeah, you can start it daily. Then when you find, if you get results, then you can do twice, once in 2 days, once in 3 days, depending on the susceptibility and the sensitivity of the patient. Yeah, Dr. Nojo, today I will, I just forgot it. Today I'll basically give your remedies what to take. I think I've told the remedy of your child and he's better also. For you, I'll just WhatsApp today your remedy, Dr. Nojo. I'm sorry, I just forgot because of a lot of other work. Yeah, so as we go further, any other questions or some questions you can always write down if I have missed out. Not on Instagram had question, but I think it has scrolled up. So as we move further in our session of a YouTube live, I should have some more questions, and fast. Otherwise, I was just telling about the rubric that spoken to aversion to. These are also very interesting rubrics, and we definitely get very good results when you see the other side of Mater Medica, the other side of remedy, and it really gives us good results. So don't be very prejudiced in only one part of that remedy. Yes. In fact, if you have seen Chamomilla, it is written by one of the authors, disposition to weep and to be angry. That is Chamomilla. But we never think about the weeping disposition of Chamomilla, That's why we only have that angry part of Chamomilla. So we have still about 5-6 minutes more, so you can always ask few questions before we close the YouTube. All questions answered or what? It is written in the Mater Medica that Chamomilla, mischievous disposition. Mischievous disposition. Yeah. So keloid after recurrent of boil. See, now a very important question. Normally when you have a boil, sorry, upper superficial, but after the boil goes, the keloid starts. So it is basically that the psychotic miasm was so much there in the patient personality, the boil was suppressed, and now the patient has developed that the psychotic tendency. So the antipsychotic medicine becomes very, very useful in this case. You must give antipsychotic and you will definitely be able to cure these type of cases. I was telling you that whenever you have injury, you have fractures and it's a compound fracture, a lot of stitches in the legs. those type of wounds, keloids are very difficult to heal. That's what I have seen in my practice. Rest keloid, if it comes automatically, it's basically because of the miasms, and then of course you can cure it better than that injury keloid. Sir, is there any medicine for cochlear nerve injury? Yeah, Dr. Annaka, there is. I must tell you one thing, that whatever I have understood in homeopathy practice, in homeopathy you cannot say that whether this disease is curable or not. If you get the constitution right, if you get the case taking right, if you get the miasm right, you will have so beautiful results in your practice, that it will be out of the imagination. It is just only that one case, that you feel that whether it is curable or not. And if your case taking goes, and if you are able to get that out, get the patient out of that disease, your confidence will increase so much. Then you will feel that everything is curable. So it's a matter of confidence to take a good case and give a simillimum, and just wait and watch how does the remedy, how does the body react. And you'll be surprised that you will get so many good results in cases where you thought, is it possible or is it not possible? Just keep reading and taking good case. That's whatever I have understood in my practice. So I hope you have understood. I hope everybody has had their answers and are able to show some results in your practice. That's important for me to understand what you want to ask, and I hope I am able to fulfill what you want, what the questions are, and I'm able to fulfill what the answers I'm telling. That's why it is very important to ask freely, so that we all can learn from the session. Okay, main book we started read. Miasm book we should read. No, organ of medicine is basically sufficient. You first start reading that, then you can read Hahnemann's chronic disease, and you then Kent's miasm, lectures of Kent's, and the lesser writings of Kent would give you good results. So I think, thank you so much. Thank you for your time, and I hope you enjoyed as much as I enjoyed teaching you. Thank you so much.